People often ask, what are the different ways to get rid of my glasses or spectacles? So there are many ways where you can get rid of your glasses or contact lenses. So for people above 18 years of age, you can consider refractive surgery or LASIK as we commonly call it. So in refractive surgery, we actually change the shape of your cornea and make it normal. In abnormal corneas, the shape there be too steep or too flat. And in LASIK, our aim is to make your cornea normal. So we can focus the rays coming from infinity to exactly on a point on retina. By doing so, you will be able to see every object without having to wear spectacles or contact lenses. There are a lot of problems associated with spectacles or contact lenses. Quite often people tell me that they're facing problems wearing spectacles, riding with spectacles, and if it's raining, the spectacles starts fogging, they're not able to see anything. They can't wear spectacles during sports like football, horse riding, even swimming for that matter. During swimming, one cannot wear contact lenses and it is very risky to wear contact lenses. I have treated a lot of swimmers who had very high power and we've made that normal, and they have good vision now. So another problem associated with spectacles are, if somebody wants to watch 3D movies, they'll have to wear these 3D glasses. And if you're wearing spectacles, you'll have to wear 3D glasses over these spectacles. And sometimes people struggle with the quality of the 3D movie that they're watching. They don't seem to enjoy that. By doing refractive surgery, you're solving all these problems. There are many types of refractive surgery. As a refractive surgeon, we have a lot of options. There are more than 45 different options, 45 different ways of removing spectacles, and my job as a refractive surgeon is help you choose that. In refractive surgery, we have laser vision correction, where we correct the shape of the cornea using lasers. We can also implantable collamer lenses or implantable contact lenses as we call them. There are many different names, then many different brands. You have Star Vision ICL, you have IPCL, and you have RIL. You have many brands to choose from. So if the power is really high and where we cannot actually do laser vision correction, we can implant these lenses. And another option is by doing cataract surgery. So cataract surgery without having cataracts, yes, if the power is very high and if we cannot implant ICL for many reasons, we can do cataract surgery also and solve this particular problem. Now there is another problem that people face in their 40s. It's also called Charlie's. So you will require, for people above 40, people will require reading glasses in order to see near objects. Okay, this is called as presbyopia. So even presbyopia can be treated by laser vision correction. There are several different types of laser vision correction that are described. So one can also get rid of glasses in their 40s by undergoing these corrections. People often ask, are these refractive surgeries, is laser vision correction covered under insurance? Insurance considers laser vision correction as a cosmetic surgery because they feel it isn't important for life. The correction is not that important for life. One can easily wear spectacles and do their job. For this matter, up to certain power, insurances will not cover laser vision correction, but after a certain power, yes. For example, some insurances cover up to after 4 diopters, some insurances cover after 6 and 7 diopters respectively. It all depends on your insurance policy. If your policy allows -4, it can be covered under insurance itself. What is LASIK? LASIK is a type of refractive surgery where we change the shape of the cornea in order to get rid of glasses or contact lenses. There are many different types. There is a type which first came out, which is called as PRK. In PRK, we actually remove the top layer of the cornea, that is called as epithelium, and we change the shape of the cornea using lasers. Usually eyes which have to undergo LASIK, usually they are called as myopic eyes. Usually people suffering from myopia are the commonest ones getting laser vision correction. Laser vision correction can also be done for hypermetropia, but in hypermetropia the eye is usually flat and we have to make the eye a little steep. So hypermetropia, when it comes to laser vision correction, we can correct only a small amount of hypermetropia. So beyond that, we may have to look into different types of refractive surgery like ICLs, or we can either do a cataract surgery to solve that particular problem. So when it comes to LASIK is a general common term used for laser vision correction. When it comes to laser vision correction, I already spoke about PRK, which was the first type. The second type is LASIK, where we use a mechanical device called as a microkeratome to make a flap on the cornea. Once we make this flap on the cornea, we change the cornea shape using excimer laser, and the flap is reposited back to its position, and the healing almost instantaneous. One says they can see clearly within hours after surgery. The third different type is called trans-PRK. Trans-PRK is one of the latest types of doing PRK, where in PRK we actually use alcohol to remove the top layer, but in trans-PRK we don't have to use any alcohol to do laser vision correction, and the eye heals very faster compared to PRK. Till now we spoke about correcting refractive errors, but there are some errors with regards to shape of the cornea. Some corneas will be very uneven, or due to a certain disease or certain injury. We have to actually correct the shape of these corneas, and these corneas can be corrected by either topo guided technique or a wavefront guided technique to improve the quality of vision in that particular patient without spectacles. And coming to the latest type, we can do laser vision correction using femtosecond laser, where in the normal LASIK procedure we use excimer laser to actually change the shape of the cornea. We actually burn tissues over here, but in femtosecond laser, again laser is used to create pockets inside the cornea, and we make a small lenticule and we remove these lenticules, and it is a very short procedure. It consumes very less time. There are many different types of femtosecond correction, lenticule correction. Coming to lenticule surgery, we have Smile, we have Smile Pro, we have Smart Vision, then we have Clear, and we also have Silk. There are many types that are available. So all these types have one thing in common, where we make a lenticule and we remove the lenticule. So we are always here to help you out. So if you need any help with regards to choosing the type of refractive surgery, what is suitable for your eyes, you can always find the link in the description. Reach out to us and we'll be glad to help you out. Do like, share and subscribe to our channel. Thank you.